Are you going overhead today? Hi, I'm Dr. Sahil, and today I will talk about how repetitive overhead arm movements like cleaning or lifting may cause serious shoulder pain, which can be a career-limiting move, particularly if you are a tradie, and what can be done to avoid this. Over time, people adapt to the symptoms of shoulder injury until they don't realize they have the problem anymore. However, you can assess whether you have a shoulder injury by looking at these common symptoms. Number 1. Recurring pain in the shoulder. 2. Arm and hand weakness. 3. Limited range of motion. 4. Stiffness. And 5. Sensations of popping on the shoulder joint. These symptoms can indicate some of the most common injuries. For example, rotator cuff muscle. These muscles can stretch and tear, which will cause pain. A rotator cuff is made up of tendons and muscles on the shoulder. A rotator cuff injury can lead to no longer being able to reach overhead to the extent you could before the injury. And impingement, which is when the shoulder tendons rub against the bone and cause inflammation. This occurs from excessive and repetitive overhead movements. Neck pain. Yes, pain in your neck can actually be related to shoulder pain. The neck's range of motion can be limited by pain, just like the shoulder's range of motion. If you have one or two tics from the list mentioned above, well, chiropractic care for shoulder pain is well tested and a research method in treating it. But, as you know, here at Balance for Life, we love to spice things up a bit. So, when we treat shoulder pain, we like to have a few things in mind. Your chiropractor can gently and safely adjust your shoulder. Adjusting the neck and upper back can also help. This chiropractic treatment will reduce pain, inflammation, and muscle spasms. Tightness and stiffness can then go away, and range of motion can be restored. Often, people work at a desk all day. They develop poor posture that puts pressure on their joints and muscles. Shoulder pain can originate from poor posture. Your chiropractor can show you a correct posture that keeps your shoulders from rolling forward and causing impingement and stiffness. For correct posture, your ears need to align directly over your shoulders. This technique can help alleviate shoulder pain over time. MLS laser uses light waves to increase blood flow and cell regeneration to injured tissues. Our laser used on shoulders will help reduce inflammation to the rotator cuff muscles and speed up recoveries. Specific exercises can strengthen and rehabilitate the shoulder muscles for flexibility. The muscles that can support the shoulder will help keep the joint stable. Keeping these muscles strong can relieve shoulder pain and prevent further injury. Stretching the muscles are important for restoring range of motion and preventing injury. Gently stretching after strengthening exercises can help reduce muscle soreness and keep the muscles long and flexible. Why I'm telling you this? It is because at Balance for Life, we know that moving better matters.